In approaching a patient with a headache disorder, because headaches can have many causes, what doctors try to do is first rule out potentially serious causes of headache. On the rarest of occasions, a headache may be a presenting feature of a very serious disorder like a brain tumor or a stroke. The reality is that although many of the patients we see arrive worried that they're suffering from something serious like a brain tumor, very often, most often, almost all the time, we can reassure people that their headaches have a benign cause. They're not going to shorten someone's life, they just reduce the quality of life of people who have the headache disorder. So our approach is to make a specific headache diagnosis. We rule out serious causes by taking a history and doing a careful neurologic examination, and occasionally we need to do some diagnostic tests to rule out serious disorders as well. And then the diagnosis of migraine itself is based on the features of the headache, the one-sided throbbing pain, the associated symptoms, the disability, the time course of the headaches. By definition, we say we don't diagnose migraine until somebody's had at least 5 characteristic attacks in their lives. Frequency varies very widely from person to person. So in the general population, the average frequency is 1 or 2 attacks per month. But in people who seek medical care, frequency can be much higher. So I will often see patients who have headaches almost every day. The issue of frequency is not so important diagnostically, but it's very important in deciding how to treat the disorder. So if someone has 1 headache a month, treatment is usually about learning to identify and avoid triggers to prevent headache, and then having effective medications to take when a headache begins to relieve pain and restore people's ability to function.